Welcome to Breaking Silos in Canadian Healthcare. This is our third roundtable, Thriving in Medicine, featuring Dr. Joyce Cheung, Dr. Joan Chan, and Dr. Duncan Rozario. This original roundtable is proudly sponsored by Pocket MD. Welcome, everybody. Thank you for coming. We're here for our episode 3 of Breaking Silos in Canadian Healthcare. Today, we're with Dr. Joyce Cheung, Dr. Joan Chan, Dr. Duncan Rozario, and we're here to talk about what it takes to thrive in a career in medicine. And for the broader folks who are interested in us having a strong, stable physician workforce, healthcare, because medicine is a shop talk term, which is what we're doing, but there's people that care a lot about making sure that we have a strong physician workforce that's sustainable for our futures. And that's a big problem. It's a big topic of conversation right now. So I'll start off with a question. I'm sure you get these questions all the time. What's the number one advice that you want to give someone who's considering starting a career in medicine? Joan, why don't we start with you?
Yeah, I think the pieces of advice, one piece of advice I'd have to offer is really hold on to the parts of yourself that light you up, that bring you joy, that fill and sustain you and give you energy. And don't be afraid of fighting for space in your life to hold on to those. And then another piece of advice that goes along with that is don't listen to the many, many physicians who will tell you that you can't have those pieces in your life and you need to shave those away or those make you unprofessional, because probably those clinicians are on their own journey to discovering what it means to actually be like fully human and have a sustainable career in medicine. And there's a lot of like hidden and sometimes overt curriculum that the only way to be a successful professional physician is to pretend that you're not a fully fledged human with other interests, with different dimensions to yourself. And so I'd want people to know they don't have to sacrifice that in order to go into medicine. And in fact, it's going to make them a more effective clinician if they hold on to those pieces of themselves.
Does that resonate for anyone else?
That is fabulous. I don't know how to top advice like that. I think the word that comes to me is authenticity. Before embarking on a career in medicine, I would say to any young woman or man, ask yourself why. Why are you interested in medicine? Medicine is fundamentally a profession of caring and communicating. It's fundamentally about talking to people and sharing their experiences and using the people skills, the things that we describe as soft skills are actually vital in healthcare. Using these people skills to alleviate the suffering that we can and the suffering that we cannot alleviate, to share and to do what we can. So it's really about communicating and caring for people. If you are a person who loves to communicate, a person who loves to share, a person who is interested in the stories of other people, then medicine is, it's not the job, it's the calling for you. Because as you know, this is my 29th year in practice. I love what I do, not because of any individual, one aspect of healthcare, but because I love interacting with people. I love hearing the stories. And the great thing about a career in surgery is I love fixing things. You take a problem and you can fix it. And so ask yourself, why do you want to do that? And ensure that your answer aligns with what healthcare actually is. It's a calling. It's not a 9-to-5 job. It's something that will capture your entire life and your mind and your family. It's ask yourself why you want to do this and ensure that everything is aligned.
I agree with you both. And I think as someone who is also a family physician like yourself, Joan, and we see our patients through their entire journey and we see their ups and downs. And there is this underlying sort of curriculum in medicine that you have to be altruistic, you have to sacrifice. And I think many of us self-select and we understand that. But as we continue on, I think even our patients want us to be balanced. They ask about us. They, ask about your time away. I hope you really enjoy this time. And I think the next generation of, clinicians want that work-life balance. And we don't talk about balance enough. I know we talk about it in medical school, but what does that really look like when you're really practicing and you have your patients and you feel committed to them and you feel that you have to be there all the time? There is some stigma about taking time off. And so, I personally believe that that really needs to be talked about. We should not feel stigmatized if, we have time off, if we take a locum. The tools that we have to do that are very minimal right now. And I think that needs to be improved and that physicians deserve a better tool to ensure that, okay, how can our patients be cared for? And I'm not the one and only person there all the time, 24/7, checking my inbox, and that I feel, my patients are cared for, but I can take the time off to be a human being. And whether that is for, parental leave or for medical leave even. And I feel that we need to look at that a little bit more so in the future to entice people to choose a career in medicine, that they can, be a physician, but have your own identity, because the medical work will always be there. Like we always tell our learners, if you want to work, you can work 24/7, right? But we want to ensure people are not burnt out and that they still have joy in their work.
Yeah, I really love that because you're so right. It's not only a choice, but it's a conscious decision, because for a young woman or man choosing a career in medicine, that is just the first step. Because after you choose that, you have to make it. Happy physicians provide the best care. And so you, at the very beginning, you have to make a conscious decision. I am going to choose medicine and I am going to make it, make my life enjoyable, make it full, make it fulfilling, ensure that I have time for my own interests, that I pursue my mental and physical health, address the needs of my family at the same time as addressing the needs of our patients. So it really is a choice, a conscious choice to make a career that's fulfilling. And I think that applies to most professions. You can be as happy or as unhappy as you choose to be. And so you institute the processes and the protocols and the habits to make it more likely that that's the case.
What's one thing that has worked for you in achieving that work-life balance, preventing burnout? Joyce, why don't we start with you?
I mean, I think personally being able to set up some boundaries and set up some time when I take care of myself. I know, sometimes we are in medicine and we have this very quote unquote type A personality. We feel like we have to do it all. I personally have a problem saying no. So I know that people are like, okay, Joyce is going to say yes to that. Just ask her to do this and to do that. And, we love to wear different hats. And I think part of that is great. And I think part of that does add to our profession and it helps our patients and we bring different perspectives. But I think self-care is really important as well. And so ensuring that you have time carved off for, your physical well-being and your family and friends and the social aspects of your life. And I think I see in my decade of experience, I know some of us have been in medicine longer, but I've also seen some of the challenges. And even within my own cohort, I've had friends of mine who had to take leave, parental leave, that was not available. They couldn't find a locum, for example. and they had to shut down their practice. So just overnight, 1,000 people without a family doctor, because despite everything that my colleague and friend tried, there was no replacement doctor. And so what we did was we actually set up a Locum platform. I know you're asking about, so maybe it wasn't balanced because we took on more work to do this voluntary startup, and we decided that, this is something that physicians deserve to be able to find, like a substitute doctor, where every other profession, they're substitute teachers, it's very normal, but doctors, we don't really have that normalized in the system that, okay, hey, I need to be away, I want to be on sabbatical, I want to go further my education, I need to be there for my own medical needs or for my, newborn or something like that. And we don't have a centralized system to have, somebody come in and help us and ensure that our patients are also cared for and there's continuity of care. So personally, I think working on that with a group of very passionate people, that's part of the balance too, is I find that keeps me going. So it's not just clinical work. I'm doing something outside, a little bit outside, adjacent to medicine, that I find is, a really rewarding project.
I think you touched on it in there, but so a locum, just for the folks that don't know maybe what that term is, it's a substitute teacher.
It's like a substitute doctor. I know everyone's nodding in the room. We understand the locum. It's a Latin term, literally called like stand-in. And so, it's funny that the public doesn't understand this, but they understand the concept that if my doctor was away, what would happen actually? And the general public, our patients would say, I'm not sure. And the general public, our patients would say, I'm not sure. Wouldn't the hospital find a stand-in for you? Right? We've literally talked to patients and they said, oh, okay, so you're saying if my doctor was away, there is no system in place. And we're saying, yes, that's the reality. You'd have to go on, for us physicians, we call up a friend or we go on a Facebook group, we call around and we say, hey, can anybody fill this gap for me? And that's the system right now, very fragmented. And so that is why we decided to build this platform, because we all believe that physicians deserve to have time off when they need it. Sometimes it's not up to them. Sometimes it's for medical leave. And we've had a physician reach out and say, I'm going for chemotherapy tomorrow. I don't have a locum. This is the situation. And I worry for my patients. I worry for myself. That's added stress. That does not, contribute to people wanting to be a part of the healthcare system, because they see that, right? So I think change is coming. I think it will change. And we have leaders that promote change and well-being and talk about this and promote this on social media. So, we're very positive that's going to happen.
I'd like to absolutely support that. You're quite right. Healthcare is a profession that will gobble up every available minute of your time. But as a friend of mine once told me, before we are humans doing, we are humans being. And to be a human, to pursue the things that really give us balance in life, we need capacity. So when I started as a surgeon 29 years ago, one of the first things that I did is I booked one day off per week. So typically Fridays. So I booked that day off because, as you know, in healthcare, we work nights, we work weekends. And if you don't book time off to pursue the things that keep us human, that time will get occupied by clinical work. And so when my kids were small, that was the day my wife would have free to pursue things that she wanted to do. As the kids got bigger, you have the capacity to take a course, exercise, maybe just do nothing. To have a day booked off called nothing, where you can do whatever you want. Imagine, most people have that capacity evenings and weekends. So much of the time, evenings and weekends, we're covering patients. We're doing call, or we're perseverating about the medical decisions that we made. And did I make the right call? Did I miss anything? And we need capacity. We need space to pursue the things that keep us human, that will give us balance, help make us happier human beings, so that we can provide better care and take better care of our family. And so what I would encourage anyone starting a career in healthcare, book a weekday or 2 half weekdays off per week, and it'll get filled with something. But if you have that capacity, then it really helps you become a more balanced human being.
It's so wild. You just used the word capacity and space, and I don't think you are familiar with my work, but that's like my whole thing. So it's so fun. It's like we just had a little symbiosis moment there, because my way of saying it is like, the most sustainable way to approach any kind of job, but certainly this kind of job where the demand is like insanely outstretching the supply, right? And actually, just briefly naming that doesn't actually have to be the way it has to be. Like, there are other countries that resource, even just like doctors per patient. Like, we could have a system where we didn't have to be doing so much of the strategizing ourselves, but here we are. And so we can make choices for ourselves in it. And so my main philosophy is intentionally working under my maximum capacity. And I like to use like the 75% rule. So like 75% of my time is booked, and 25% under my capacity is free space, free time. So that includes like time away from clinic. Even like when I look at my schedule, trying to like, yes, I could see more patients per week, but I'm actually going to hold space so that if I know me or my kids get sick, if there are urgent issues or home visits I want to do, I actually have clinical time set aside for that. Also, as a family physician, there's just a couple forms we have to do. I don't know if you feel the same.
Just a few.
Just like a slight bit of paperwork. And so like actually booking time for that, so then when I am off on my evenings, I am not doing that paperwork, like really protecting my time for me, knowing that then that actually means I am resourced, I am satisfied, I am joyful, like happy doctors providing more effective care.
Absolutely.
Like not only like making less mistakes, being less snappy. Like what are the kinds of interactions that you end up then, get you the bad rate MD? It's usually not that the person's like a maniacal villain. It's usually that they're extremely burnt out and they lose it on someone, right? And they don't have the bandwidth to have that emotional connection. So we can protect that bandwidth. Will that mean that we see less patients? Yes. We can be creative then about how we still offer equivalent or even more care. So one of my strategies is I hired a nurse practitioner who works in my office and sees patients when I'm not in the office. And like right now, I'm here doing this podcast because I've been off for the last 3 weeks actually from my clinic, and she's been seeing my patients in my stead. So like normalizing both for us within the profession and also patients. Right now, we have like a very like monogamous relationship thing. Is I think especially family physicians, but any physician where you're like, you're my only one and it needs to be you. Like PSA, you don't want that to be the system. That's like, it's nice to have a special relationship, of course. But like, one of my things that I'm trying to build out is like, look at this team of wonderful people. I've hired people who are like-minded to me. Like you're going to benefit from seeing them as well as me. Like we're going to do case conferences and like put our brains together to care for you. Like, so shifting the conversation to like genuine team-based care, like, and where the patient isn't like my doctor is Dr. Chan, but like Dr. Chan and team, or like, some other name. That's a culture shift that patients are probably not going to demand of us. So we have to say, hey, this is the option I have to offer to you. And so those are some like pragmatic, like work-life balance things. It is about like discovering your joy. And if you want to do yoga and meditation stuff, that's cool too. But like pragmatically, I love that each of us have actually said a pragmatic practice management strategy, because those are the things actually I think we need, like in the wellness seminars, like that's actually the most effective stuff. And then also learning mindfulness and things is good too. But like working less than the max,
Absolutely.
that needs to be one of the like normative strategies. It doesn't mean you're lazy. It doesn't mean you're an underproductive whatever. It means that you are being a wise, sustainable clinician who's going to be playing the long game and providing high quality care for the long term to your patients.
Absolutely. I love that word capacity
Yeah.
because it reminds me of the word that I use in my office, nothing. If you look at my office day, my secretary, of course, in my EMR, she'll book patients, but she'll book empty spots throughout the day that she calls nothing. She told me once, I'm going to give
I
you
love that.
some time to do nothing. And sometimes I do nothing, but other times I'll catch up on dictation. And the result is you're happier through the day. And by the end of the day, you finished all of your paperwork and your dictation, and you go home as a human being, not as Doctor Part 2, catching
Yes.
up on all the work that you didn't finish in the day. So I love that analogy of booking less than 100%. Book some nothing through your day. We should all book a little nothing in our days.
I love calling it nothing. I'm
Yes.
immediately, because right now it just
like
says
that.
block. I'm like, no, nothing. To be
Yes.
clear, nothing is going to happen
Yes.
here.
Have a snack, have a coffee,
Negative space.
sit in your chair quietly and look
Oh.
out the window.
And I love your admin staff gives you, it's almost like you get permission to do nothing
Yes.
when nothing is booked in your schedule. And it's sort of, you give yourself permission to take that time. You normalize that, having somebody cover for you, having a nurse practitioner, some sort of physician extender cover for you, a locum physician cover for you when it's a certain time of year that's really important for you, maybe the summertime or maybe the winter time, and take a little bit of extended time off. I would say, a decade in the game, in the medicine game, I've never taken more than 2 weeks off at a time. And that just seems to be normal. So every year I would say, oh, this is my big vacation. I have 2 weeks off in a row, but I'll be out of the country and I'll still be checking my inbox. And that is normal. And, we know how to do it. We know, okay, we have to log on to the VPN and do this special thing so we can check our inbox. And I know like my other co-guests here are shaking their heads. But
it is
there is
common.
that, it is
Oh, yeah.
common. And, and I think it would be lovely for me to be able to get a locum and say, hey, this is the time. I know my patients are taken care of. And even thinking about the future of medicine when you're talking about our learners, our students enticed to go into medicine, it is very competitive. So everybody, is very dedicated, usually very committed. But those are also the people that would burn out if you just let them continue and without a break, right? And so I think the future of medicine will look more flexible, and we need to build that redundancy in the system ourselves. And these are the pragmatic tools that people could use to say, if you were able to get a substitute doctor at the click of a button, and you could say, I need a doctor here for 4 weeks, and I get my substitute or my locum, and it should be as easy as booking an Airbnb. And maybe do it at the same time. You go on our platform, you book your locum, and then you go on the Airbnb platform and you book your vacation away, whatever it is. So that's really our hope in doing this extra work. And, we really hope that we would change this culture and normalize.
And another like pragmatic thing to consider, because I know having given like a couple talks to family physicians, and sometimes one thing is what I suggested, that when people take a vacation, they don't check their inbox, and like people are like offended. So like part of
Yes,
it is
yeah.
the
What?
self-concept of like, no, like we have to not be monogamous to our practice either, of like, don't think you're the only one who can do a good job. Like there's some really toxic mindsets that can get in there and make the whole thing problematic. So that, and then also again, just like if anyone who's in leadership in healthcare wants to just remember that this would be really wise to actually just have as a systematic part of how things are funded. And there's like signs that things might be shifting, like if the faux plus model actually comes into effect. That's just for primary care. So sorry, but that it would mean that potentially you could hire a locum and probably still pay them some amount, but then they could bill an hourly rate just to OHIP. And that would make it way more affordable to have a locum. And I would hope that then OHIP would extend that to every specialty. I mean, specialists are even like rarer commodities, very precious in the healthcare system. And you all also definitely need to have time away and backups and to have that be funded. Like, it is such a design flaw that the system is like one
person,
one to many.
and that's it. Yes.
I mean, you do know that one is a human, right? And it's like deeply ironic that it's the healthcare system, and yet our system isn't like proactively remembering that the people who work in the system are definitely going to get sick at some point, or, you know, it's an interesting flaw that I'm so glad your platform exists in the meantime, because like we definitely need to make it easier to be replaceable.
Yeah. And there's a whole mindset change required among clinicians. Clinicians need to understand, yes, you are a valuable part of the system, but you are not indispensable. You are replaceable, and that you should actually embrace that. You should embrace the fact that other women and men can do what you do, and maybe to the same quality or even better. Consider that.
Wonderful.
And we need to accept that. And historically in surgery, there's been resistance to that. Only I can look after my patients, and that's, of course, that's not true. And if you look at what we did in Oakville about 8 years ago, we introduced what's called acute care surgery, or ACS. There are lots of women and men trained in surgery who don't have full-time positions. And so what we did is we hired 3 general surgeons simultaneously, and we created an ACS service where these surgeons look after the emergency room, inpatient consults, the floor, and we provide them with operating room time, clinic time, and that gives us capacity so that now, Monday to Friday, 8 to 5, no one pages me. I can have an elective practice. And we share evening call, we share night call, but our department went from 8 to 11 surgeons in one shot. And I realized I'm not indispensable, and it's a good feeling to not be indispensable. It's, you know, it's good to not be paged when you're doing elective work. It's good that we have other women and men in the system providing care and providing excellent care.
It is like, it's such a norm, and it's no individual person like drop the ball, but just like it is so bizarre that in this system that it is a norm for someone to be expected to do one job with like focus and attention and need for high quality, and be simultaneously on the hook to do another job. And like, in speaking, we're all quite urban, but like our rural colleagues, where like I have friends and colleagues and people I coach who like, they're literally like had to cancel my whole day because an emergency happened at the hospital, which is next door. And literally it's all the same doctors running both. Like, what? You know, like if someone would not design the system from scratch that way, they'd say, well, if there's 2 jobs to do, let's have at least 2 people, so 1 person per job, right? And then even beyond that, let's duplicate so that there's backup, so that there's even just like ideation sharing, so that, you know, people aren't taking on a singular load by themselves. We're not there yet, but hopefully we can get there.
I think if we look about, you know, we're all in the golden horseshoe. So I think in terms of accessing specialists, we're very lucky, and our patients are very lucky to be able to access all sorts of specialists and healthcare. But in the rural regions of Ontario, even, right, I think the care is very different. And the patients up there may actually rely mostly on locums coming up and doing this work. And to be honest, I would love to go and do a rural locum and serve the communities in all of these underserved areas. But when I think about the logistics of having to do that, which would mean I would have to find a locum for my own practice here in Toronto, and then I'd have to book the exact same time to do the locum up north. Right now, that would just be too difficult. So there's really minimal physician mobility for us to go help in those areas right now. And I think we have to, again, build that into the system because our patients, deserve better. And if I was in a remote area, if I had, some issue, an accident or something like that, and you go to the Emerge and you just think, okay, well, it's okay. I'm going to go to the Emerge. And there was no, locum emergency doctor there, which could happen and does happen. That is a very distressing thing to think about. And some of my patients who, are away or they've moved up north, they don't realize that a lot of the healthcare system is concentrated in urban areas. And they hang on to me as their family physician, even though they live 100 kilometers away now or something like that, because there just isn't anyone in those areas. So I think physician mobility within the province is really important, and being able to support that system is something that us as a profession should think about to ensure sustainability as well.
Yeah, imagine that in any other profession. You're an airline pilot, you're a bank executive, you're a hospital administrator. If you want to take time off, find someone to replace you. Otherwise, no time off for you.
And we have
Exactly. Yeah, good luck.
I don't
and we have a shortage.
Yes. I don't think people outside of healthcare understand that that's how it works. And that's a system failure. We have a lot of policies and processes and historical practices that are unhealthy and unsustainable. And when I see what the younger physicians are doing, they're saying, that doesn't make sense. I'm not going to do that. Let's change it. It's a breath of fresh air because, historically, when I look at the surgeons who trained me, there were a lot of unhealthy practices that went on. There was a lot of unhappiness, a lot of divorce, a lot of challenges, and it doesn't have to be that way. We can actually create a better system that is sustainable, a system that attracts people to the profession for the right reasons, and keeps us healthy and keeps our families rewarded as well.
If there's one thing that you wish the general public knew about what it's like to practice in the healthcare system, what would it be? Joan, should we start?
Only one thing. I'm like, oh my gosh. Well, I mean, at a basic level, I think it would be useful for the public to understand that physicians are humans too. And a piece of why, when people forget that, to say it's not typically because, again, they are self-absorbed or something. Like, you see all the time with patients and how they are dehumanized by their industry and, their lot in life. And so it makes sense that then they would forget that we are too. But like, if we can each be witnessing each other's humanity more, I do think that would make a big difference, and it would shift expectations to be more reasonable. And so beyond the patients themselves, but like their employers, there's so much, like the form thing, the sick note thing, like the way that people are treated when they are unwell in all workplaces is really horrible. And then that comes to our doors, and then we're asked to address it, right? But like, so having like not only people themselves, but their workplaces understand that like this system is a precious resource. Healthcare is a precious resource. It is a finite resource, and it is staffed by humans. And if we all kind of thought that way before, government made policy decisions, employers decided their sick note policy or how often to send forms. Like these seem like small things, but actually, they are not small things. Like even things like the government is going to, I think, mandate that everyone over 70 something will have to get an annual driver's medical. I don't know if you heard this. I think that's like still upcoming. Again, an example of like, did everyone sit down and say, this is a finite resource staffed by humans that already have more than a full plate? Now, if we're going to ask them to do something else, and so like every level, policymakers down to individuals, like understanding finite resource, staffed with humans, genuinely trying to do their best, we could just offer each other some grace. And that also, I will say, applies to clinicians. It's not easy, but when maybe you're having a stiff, snappy conversation with a specialist, or if we can often turn on each other too, right? And that is unproductive, and it's because we're all like underwater. But again, so it's like, like you are a human too. So how can I, and I am a human too. So how can I treat myself with the kindness, love, and respect I need, and then therefore resource myself to treat others that way? If we do it in all the directions, I think there would be a lot more, like grace, understanding, natural compassion that would exist in the system, a sense of patience. And I understand why people are impatient. And like, the numbers are the numbers. The math is the math. This is the system we have. It would be very useful if people really recognize that globally instead of taking on us individually, which happens a lot with like wait times for specialists or whatever. And then, it's fine. You have a conversation like, I hear you. It is terrible. And would you like me to help you with care today? Right. So if we had that sort of radical acceptance of almost just exactly how bad it is, like, you're right. Okay, but we're in this together. There's actually no one outside. Like, we are actually all in this together. That would be a welcome shift in approach.
I love that. My one advice to the general public about healthcare would be avoid the need for healthcare. My classic line that I tell my patients is, you should avoid surgery as much as possible. And what I think the general public and all of us, even in healthcare, need to understand is that we should do our best to avoid the need for healthcare, meaning pursue a superbly healthy diet, exercise regularly, look after your mental health, foster your social connections, and aspire to be on no pill, to have no surgery, to be able to do your daily activities with joy and without pain, and to age well. That would be my one advice. So much of the challenges that I see in healthcare are lifestyle, whether it's heart disease, stroke, cancer, diabetes. So much of the illness that plagues all of our societies are lifestyle related. Pursue the need to not need healthcare as much as possible, and you will have a much more joyous life.
I think the public maybe views doctors as having much more power and advocacy than we actually do. And I think people, don't realize that because we are sort of held to this higher moral standard oftentimes, where we have very high expectations for ourselves, and failure or mistakes are not permitted, right? But I think if the public knew, we are these human beings that are just trying our best to hold the system together. Oftentimes I just feel like I'm a piece of Band-Aid just trying to hold things to the best of my ability. There would be more kindness. People are often shocked that everything outside of the hospital system, all of these clinics that we have, these are just little medical facilities that physicians have, built up. And they don't understand that, we are independent business owners that are trying to do this so that we could scale medicine outside of just within a hospital's walls. and that we have to manage all of that, that we're there, often all the time, because we have to ensure our staff is supported, we have to ensure our patients are well cared for, and we also financially have to provide for all of these as well. So this is very surprising to the public that, sometimes they think. I've had a teacher patient tell me, oh, I just thought that, you guys would have, benefits and insurance and pensions. And I say, no, actually, that's not the case. And so oftentimes, even for us to take a leave, right, it comes at a financial cost. And that really shouldn't be the case, that we feel 100% or 200%, tied down. And so if the public knew that, hopefully they would fight for us too. And they might say, wow, this is a very strange system that, you have to set up all your medical facilities yourself, and that you have to hire your own medical office admin and pay out of pocket, hire your own nurses, pay out of pocket. And if you have to go away, you have to pay your substitute doctor out of pocket, and you don't have any time off, really, that is, provided as any sort of job benefit for you. I think people would be very surprised and probably shocked that this is allowed to happen in our system, to a group of people who, are trying to help.
Caregivers, and that operator role, in addition to being a clinical expert, what you're describing is an operating a business.
As a primary preceptor for family physicians, they encourage you to show your practice management to your learner when they're with you, but it is still very kind of fumbling through it, because it's not the norm of how it was. It was sort of you, and learners, understandably, they're kind of overwhelmed trying to learn all of medicine, so they don't always also have the bandwidth while they're still in training. I think it would be really fabulous to have things formally set up for ongoing, specifically business and practice management mentorship when you're in practice, because then you realize HR laws exist. What are they, and am I violating them? Really, I don't have any formal training. Learn as you go. What I did is I joined a practice that was well established and had norms, so they had some knowledge.
Yeah.
But really, it is so bizarre that the training is not there, because it impacts patient care. First of all, the customers of your business are the patients. So how well you care for them includes how well you operate the facilities to which they come to, you know what I mean?
Yes.
That whole thing. Plus, if you're really stressed and burnt out, you certainly see where clinicians can get into the mindset because of financial difficulties, where they're I have to see more patients because otherwise I can't afford this. And now you're seeing patients purely as a paycheck thing. That's not a great place to be, right? So wise and sustainable business practices needs to be a bigger piece of the conversation, and needs to be something that we talk about. And it's also a politeness thing, don't talk about money. We need to be talking about money with each other way more.
So maybe a practice management course, how to ensure that
would be
HR
great.
practices are upheld, because as physicians, we violate HR practices all the time. We don't take lunch. I eat in front of my computer. Employers usually say, you have 1 hour lunch, you have a 15-minute break for, biology for nothing. And we don't incorporate that. And our learners see that. I'm in a community practice as well. And I just think to myself, if my learner just saw me eating in front of my computer every single lunch, what are they going to think about this? So I think normalizing that is really important. How to manage your practice effectively, how to take breaks effectively, and give yourself that time, whether that is a short break, in nothing in your schedule that you just put in 15 minutes, nothing. Okay. Not too much of nothing, I guess, but, and then taking, a longer break for yourself so that you can have a sabbatical or attend to your family's needs, whatever that might be.
Yeah, and often it's the people outside of healthcare when they watch us do these unhealthy, unwise practices, they'll point them out. After many years of doing an on-call Sunday and working a full day Monday, a few years ago, my wife pointed out to me, "You're awfully tired and irritable on that Monday. Why don't you take the day off?" And so now, if I'm on call Sunday, I take the Monday completely off, and if I'm on call on a weekday, I'll take the next morning off. And so things that regular people would consider normal, we're shocked to actually implement these things. But when we start architecting this, when we start implementing processes that are good for us and good for our patients, good things happen.
So we're nearing our end of our hour together. I'm just want to ask, this is my favorite question. So if you weren't in medicine, what would the job be? What would you be doing? Duncan, let's start with you.
I would be in Silicon Valley creating technology solutions to address the problems of society. That was my tech, healthcare. I was trying to decide what to do, and my father told me, "You can be a physician practicing tech on the side, but you can't be a IT technology person operating in your garage." So I chose healthcare, and I have to say I've had no regrets. But my children are both in tech, so they pursued that in some fashion.
Awesome. And you do tech. You're not in
correct.
Silicon Valley. You're here, but
Correct. I've got a technology startup, as you know, and so I managed to pursue that. And I realize there's nothing quite like healthcare. Technology is wonderful, but dealing with people instead of dealing with screens is far more rewarding. I have no regrets.
I actually feel the same. Like I would still be doing something where I'm having really curious and connected conversations with people, so that's, I think, so my side gig is podcasting. And it connect, I hear when I interview people on my podcast, wow, you're such a natural conversational interviewer. And I'm like, yeah, it's literally my day job is doing this with patients, but there's something very fun about doing it without that same agenda. Instead, like we've done this past hour, just having open conversation. And so I think my career would have been something like that, maybe whether it's teaching or journalism or something still, but where I'm getting to know fascinating, because humans are so fascinating. We're all the same species, and it's just so wild. And so just something where I get to discover and learn about other human beings and hear their story and share mine and share ideas about how life could be different. Something in that realm.
I thought you were going to say musician. That was going to be my first guess. And
no.
yes, you're a podcast. You have a podcast, The Other Human in the Room,
That's
right?
Yes. Yeah.
Thank you. I thought you were going to say, sorry, go ahead. What were you saying?
So I never would want to be a professional musician. I'm firmly amateur.
Because you do play.
Yes.
Yes.
Yeah,
Taylor Swift is your,
that's right.
because I follow you
on
in your content.
She is
so
my current obsession.
Yeah.
And I taught myself the ukulele specifically so I could play and learn as many Taylor Swift songs as possible.
Very nice.
And but I also know the firm belief of needing to have joy, pleasure, creative practices that you will never make money from. That's actually a very important source of resourcing yourself as a human than for the work you do that is more your profession. And so certainly, but just talent wise, and also the stress of being a musician. I want to be a musician for practice, not for profit.
That's an interesting question. My answer is going to be a bit lame, but I really do enjoy medicine and I do love it. I'm a family doctor and a palliative care doctor, so I talk to people all day. But, I really find those connections is what keeps me going. So we do see there are inefficiencies in the system. I like to look at that. I like to tackle it. And that's why we started this Locum platform, because we saw that that was a huge gap, that we don't have a centralized system where we could find a substitute doctor. That is something that even our medical association has asked for. So if you look at our arbitration briefs, we have asked for a locum pool so that we could ensure physician sustainability and improve mobility across the province. We still don't have it. We asked for it to be done in April. So we've sort of taken that into our own hands to do. So I hope that I can continue doing things like that outside of medicine while also balancing my clinical career. And as I've continued to practice, as a family doctor, we see patients from 0 to 100. And as a palliative care doctor, I've had widows of my palliative care patients ask me, can I sign on to your family practice? Because now we are trauma bonded. And now you know so much about them. And so those connections, now I have all of these people, generations of patients within my practice. And I think that is something that is really special. And I think that is something that we want to preserve, even though I know I have to let go of the idea that I'm the only person that knows them and cares for them. And that is something that takes a lot of practice. But in the future, I think we will be seeing more of that flexibility, that redundancy, so that we can be sustainable and that we're able to be, the better doctor to our patients.
Thank you. When did you know that you wanted to be a doc?
To be honest, I never even thought about it. I didn't do any of the usual hospital volunteering or anything like that. But I did my undergrad in sciences, and I thought, I guess I'll do my MCAT and see what happens. And I was very lucky. So I got into medical school right after my undergraduate, and here I am. So I stumbled into medicine. So I'm very lucky to enjoy it. And I found a niche that I find very rewarding.
Okay, that's it. Thank you so much for joining us. Thank you. If you enjoyed this original roundtable, click subscribe and turn on the notification. Don't miss our next roundtable.